We're going to begin by foam rolling or using a massage ball on your quads. So the muscle we're working on here is called rectus femoris, and it goes from your knee up to your hip. So this one actually works as a hip flexor as well, which is why it's particularly important, because if it gets short, it can stop your glutes from working. So the idea is to try and go at a rate that your body will release that. So you're looking at, maybe getting to an 8 out of 10 in terms of discomfort. And when the muscle eases off down to about a 3 or a 4, you move on to the next bit. So you can take as long as you need to doing this. The idea is to try and get the muscles to release and try and increase the length of them, really. And then when you've done one side, just simply repeat and do on the other. Again, following the same principle. So trying to get to about an 8 out of 10 in terms of discomfort. And when it eases off down to about a 3 or a 4, then you move on to the next spot. And then as well as this, there's another little muscle called your tensor fascia lata, which also works as a hip flexor. And that sits right up the top on the outside, as you can see in the image I'll put up here. So it's good to spend a little bit of time there as well. It can be a little bit tender, that one. And then gradually working around onto your glutes. This is into your glute medius, so on the side of your hip, just below the line of your pelvis. As you can see, you'll see different trigger points there and different referral patterns. So sometimes you could have lower back pain, and it's actually this muscle that's just a little bit tight. So it might feel uncomfortable while you're massaging it, but often it feels a lot better afterwards. And then we'll also do a little bit of work into the hip flexors. So this time you'll be working just above the line of the pelvis. You can't really get in very deep here, it's impossible really, but you can get a little bit into the fascia, as you can see. So often these are sort of the muscles you'll see visible on athletes. And as you move around the back, you get into that little muscle there, quadratus lumborum, which could be the source of a lot of lower back pain, but we want to try and make sure it's nice and loose before you start. And then working around the back into your glute maximus. And you can spend a little bit of time circling around the ischium, or your sit bone, and then getting into that little muscle there called the piriformis, which can often cause a lot of problems because of its location on the sacrum. It can really affect your back, that one. So it's good to make sure that again is loose. And as you get your glutes stronger, then that one should become less of a problem, because it often comes in and overworks when the glute med is weak. And again, we're just basically repeating the same thing on the other side. So with all these things, remember trying to get to about an 8 out of 10 in terms of discomfort, and when the muscles ease off to about a 3 or a 4, then you move on to the next one. And again, you can just go at a rate that works for you, basically. So I often find that I'll spend more time on my right side because it tends to get stiffer than my left. So, you can pause this video and spend as long as you need to, really. But as you do more of these, the muscles will get looser, and you'll need to spend less time doing it. So again, same thing, trying to get into the hip flexors, and then working around onto your glute max and back into the piriformis again. So when we've done these, we will give them a stretch as well. But before that, we're going to do some nerve glides for the psoas, just try and get the area freed up, really. Sometimes if you get a change of sensation on the outside, maybe a bit of numbness or a bit of sort of tingly sensation, that can often be due to a restriction in the hips. So with this one, you're going to lie on your front and then just push up onto your elbows. And then the idea is to bend your head up, and at the same time you bend from the knee and lift your foot up. I'm just going to do about 5 of these on each side. but what it helps is with just getting the nerve to glide through the tissues. And then we'll do the same on the other side. So again, just 5 on each side. So after these, we're going to work round onto the back and just try and get into the muscles on the back of the shoulder blade, which can often get a little bit tight into the muscles of the rotator cuff. And then from there, what we're going to do is, after spending a little bit of time there, try and get your arm in as close to your ear as you can. And then just going to work down across the ribs. So the idea is try and get the thoracic spine to open up. So all the ribs should be able to move. It should be quite a flexible area, because obviously we need to breathe. So as I say, you're just going to go all the way down and then all the way back up. And after that, we'll just do a little mobility exercise, try and get the thoracic spine to open up a little bit. So as you might notice, it's a Pilates style exercise called thread the needle. So what you need to do is look up. So you're trying to get your whole spine to rotate and then reaching through the other way. So again, just doing about 3 on each side of these. And then next, working on trying to get these hip flexors to stretch. And again, this also forms another glide. So if you're looking up, reaching up, just trying to get the nerve to move through the tissues, just helps the hip flexors release off. And then taking it into a quad stretch, again, trying to stretch that rectus femoris. So ideally what you're trying to do is try and keep your knee behind your hip and then squeeze your bum, pull your tummy in to try and stop your lower back from arching. And then you get more effective stretch. If you need to, you can always use a towel. So if you can't quite reach your leg yet, if it's not very flexible, then just loop a towel around your shin and then pull up using that, or a belt, something like that. And again, same principle applies. So make sure when you're stretching, mild tension, not pain. So we want the muscles to stretch, but we definitely don't want to tear them. And then after these, moving in some glute stretches. So this one here, we're just going to move up and down on the hip. It just helps mobilize the hip and keep the SI joint free. And then aiming your knee underneath your opposite shoulder to stretch your glute medius. And as you do these, try and make sure you keep your head up to keep your back straight. So what we want is the glutes to stretch, not just to bend your back. And this is a piriformis stretch. So with this one, you're increasing the angle at your knee, and you'll feel it more on the outside of your bum, a bit deeper inside. So again, same thing, just a quick mobilization. So just about 5 times, moving backwards and forwards. And then knee underneath the opposite shoulder. And then again, keep your head up to keep your back straight. And then increasing the angle at your knee, aiming your chest over your piriformis. Then after these, we're just going to go into what they call the rest position in Pilates, or the child pose in yoga. But with this one, I want you to try and keep your bum up in the air to try and open up your thoracic spine. So the idea is you keep your bum quite high, and then just use your body weight to try and drop your head down, and hopefully eventually you'll find your head on the mat. But the idea is to really try and encourage that thoracic spine to open up, because it can get quite kyphotic or kyphosed, which means basically rounded shoulders. And we're trying to get that to extend and really open up. And then after these, we'll just do some glute activation exercises. So what you're doing here is just getting your heels as close to your bum as you can. If you put your feet further away, like in that position, you'll feel it on your hamstrings. So you really want your heels as close to your bum as you can. And then if you put your fingers on your iliac crest, so the bony bit on the front of your hips, and then your thumbs on your ribs, try and keep that gap the same, because what we want is you to keep a neutral spine and extend your hips. So you engage your pelvic floor and squeeze your bum, and what you will feel is a stretch on the front of your thighs. but that's not the muscle you're working. You're trying to work your glutes. And obviously, when you start doing swings and things like that, this is what you're trying to achieve. So you want a tight core. I want you to squeeze your bum and fully extend your hips. Now, after doing about 10 of those, just give your knees a little hug just to release off.